ladies and gentlemen, may we now call this meeting the second technical working group of the Health Committee tackling the draft consolidated version of the Philhealth amendatory bills in order. Before we begin with the highlights of the TWG discussions last week, I would like to introduce during the last technical working group meeting so that they can be recognized and they can introduce themselves. Yes, can we start with the lady? Introduce yourself.
Good afternoon, I'm Attorney Pulido from Reference and Research Bureau, the Drafting Service.
House of Representatives. Okay. Yes, Doctor.
I'm Dr. Fresco Yapendon. I'm the President of the Philippine Academy of Medical Specialists.
Good afternoon, I am Attorney Edward P. Chico. I am the Corporate Secretary of the Philippine Academy of Medical Specialists.
Dr. Saraben, my friend.
Anyway, I think in as so far as the enumeration of the services, I think the author has already, or the principal author of that bill, particular bill, has already yielded to the scrapping out of that statement. We have been enumerating services, and I think it is also best if we hear from Dr. Fresco the payment or reimbursements of Philhealth as part of the benefit package, yung services of healthcare professionals. I think yan yung itatanong mo, di ba, Doctor?
Yes, sir. Sa ngayon po, ang problema po namin sa PhilHealth, sa palagay po namin, meron pong discrimination, arbitrary classification ng mga doktor, lalo na po yung mga doktor sa government at yung mga nagpa-practice sa rural health or sa mga probinsya. Kami pong hinihiling sa inyo na pag-aralang mabuti yung pagka-classify. Marami na hong problema ang mga doktor. Nag-aalisa na may exodus of doctors, mayroon pong pagbaba ng enrollment ng ating mga medical school, doctors are demoralized, and it seems that the remuneration given by PhilHealth is adding insult to injury. I hope the body would give us more time or perhaps give us another meeting for us to straighten up with PhilHealth regarding the remuneration of doctors. Kami po ay 42 chapters nationwide. Most of us are servicing the government hospitals. Many of us are graduates of government hospitals, and many of us are rural practitioners. Pero recently po, napakarami po ng mga doktor na dinowngrade ang kategorya ng PhilHealth. And we were surprised because in the news, PhilHealth is claiming to have a lot of money. I really don't know if that is true. But I think doctors are partners here, and we should be taking care of our doctors so that our doctors will be taking care of our indigent patient.
Thank you very much, Doctor. I think if I can summarize it, because Dr. Fresco a while ago mentioned to me their problem. I think for him, their organization, the Philippine Association of Medical Specialists, or Pams, is complaining how come their members would receive less performing the same service to a patient vis-a-vis a doctor coming from another society. Can you please give an example, a specific example? Let's say appendectomy, yun ba?
For surgical procedures, sir, only members or diplomate and fellows of, let's say, PCS would receive a higher remuneration. Alam naman po natin na karamihan po ng mga doktor na sinasabing miyembro ng mga specialty societies are practicing in private hospitals. They are here in Metro Manila or the different cities, no? Pero ang naiiwan po para sa mahihirap, lalo na po sa mga probinsya, eh yung kakaunti na lang pong doktor at karamihan doon po ay miyembro ng Pams. And we are being classified or degraded into GP on the basis of our society affiliation rather than assessing the individual capability of doing such procedure.
Can Philhealth answer that?
I believe there have already been several meetings with regarding PAMS. The societies they mentioned are the societies that were recognized by the Philippine Medical Associations. These are the eight major societies. Unfortunately, PAMS was not included in the affiliates of the 8th division. Discrimination, it all boils down to credentialing or the training modules that were accredited training modules that were that has each society has the members of each society has undergone because that was the
Doctor, I
issue.
think ang wisdom kasi na nakikita ko dyan, there are doctors who belong to who are older.
Yes.
Na when they were practicing, wala pang mga medical society sa mga yan.
Yes, sir.
Tapos biglang tinayo yung medical society sa mga yan. Of course, sino ba lang naman yung nagtayo ng medical society na yan vis-a-vis yung pinagkakatiwalaan ng kanilang komunidad. Bigla na lang, nung nagkaroon ng Philhealth, hindi sila binabayaran ng Philhealth. Na alam naman nila na naging professor pa nga sila nung naging member ng mga societies na yan. So, yun po siguro yung hinanaing nila. I feel their sentiments because I was once part of the rural doctor before. And yan yung mga wala. And ako ay sa aircon. Diba? Yan yung nagtatrabaho sa field, no? Tapos sila pa yung ano. So siguro it's just but necessary na ma-explain lang natin siguro sa kanila, no? Kung bakit gano'n ang may discrepancy.